Just move your finger, you'll feel a cord-like structure slipping under your finger. As long as we are away from the sciatic nerve,
we're safe. I mean, it's a major contributor to the blood supply to the head of the femur. What initially drew me to surgery is you have a narrow time slice in your patient's life, and you get to use that opportunity to ultimately achieve pretty good outcomes most of the time, hopefully. Why the Aga Khan University? Well, I was impressed with their philosophy. What they're interested in is what have you learned from this particular patient or from this particular case or condition, and how does this translate into making you a better clinician? Briefly, you have the roots running and two roots combining to give you the trunks, which are either superior, middle or inferior, and then subsequent.
Miriam is, I would say, an ideal resident. She constantly challenges us, and I think she's going to be an excellent doctor in the future.
I've had to have a turn in my perception of what it is to be a surgeon and how it translates to patient care, so it has more than met my expectations.
It's an important question to know what is the perioperative mortality and morbidity.
Should we change our practice then? Because the impact of this very large trial, not randomized, but just on the strength of that data of the volume of patients, should we change our strategy?
I also like that there's a strong emphasis on research, and that was actually one of the second selling points for me. What I'm hoping to do is set up a strong center for research. What I feel is one of our gaps locally is that we've had brilliant papers coming out from the region, but very few by the local population. So there is indeed need for, I would say, the renaissance of the African surgeon, or the African scientist, as it were.
So one of the key things, Saida, that he's doing is making sure first there's no pain or discomfort, because patient comfort is key.
At the end of the day, we're not being trained to be just surgeons, you're being trained to be leaders. And how that translates is what can you give back to society? I mean, it has to start now. And unless we take the initiative and run with it, then nobody else will.